Oh, hello there. Welcome to the clinic. My name's Dr. Sarah. Make yourself comfortable. Okay, so let's just see. Could you just confirm your name for me? Right, that's fine. I've got the right notes, which is always a good start, isn't it? Okay, so let's just see. You've called into our triage team and they forwarded your details to me. Let me just see. They've reported that you've been having several symptoms that they felt you needed to get checked out. Okay, I'll go through a few of those with you in a second. Okay, can you just confirm your date of birth for me? Okay, so that's all correct. Just bear with me. I'll just have a little flick through the things there. All right. So, you're not feeling too good today? No. All right. Okay. Well, we'll see what we can do to get you feeling better. Yeah. All right. So, they're telling me that you've been experiencing some weight loss. Okay. Do you know how much weight loss? Okay, several pounds in a short space of time. Okay. Do you know your current weight? Okay. Would you just like to pop on those scales to your left? Okay, thanks. Let's just have a look. Okay. All right. Just take a seat again. Okay, so they said that you're quite restless and your sleeping is poor. Okay. You feel you've got a faster heartbeat. Okay. Is it a lot faster than usual? Okay, and is that a lot of the time? All right. Sometimes you feel you can't swallow as well? Yeah? Okay. Is it painful to swallow? Just a little bit uncomfortable, okay. And you feel that your hair has changed, it's a little bit more brittle? A little bit, feel like you may have lost a little bit? Okay, well, I'll check that over shortly. And that your eyes are feeling dry too? Okay, so you've got quite a few symptoms there, haven't you? Okay, and this has been going on for several weeks. Okay. And you thought it was stress related, okay. Do you have stresses at the moment? Particular stresses? Okay, so it's just a few job and money worries. Okay, well, that's enough to cause stress, isn't it? Okay. All right. Obviously, there's a few things that could cause those kind of symptoms, and anxiety and stress being one of them. But looking at it as a whole, it could be that your thyroid isn't functioning quite properly. Those symptoms are very common in an overactive thyroid. Okay, have you heard about the thyroid gland before? I'm sure you've heard people say, oh, I'm underactive or overactive. Okay, the thyroid gland is situated in your throat. It's a butterfly-shaped gland, okay, in that area there. Now, it's responsible for controlling the metabolism in your body. It secretes hormones, okay, and it controls heart rate, digestive processes, brain function, and even bone development. Okay, it's very, very important. And normally, when it's functioning as it should, you'll be ticking along fine. Okay, your body will be metabolizing things at the right rate. You won't be getting any unusual symptoms. All right. Now, if your thyroid gland becomes underactive, you may notice that you're feeling more tired. Okay. You'll put weight on easily. Okay, you'll feel rather sluggish, and sometimes despite your best efforts to try and lose weight, you don't, or you keep gaining weight. Okay, now with an overactive thyroid, which is what I'm kind of thinking could be what's going on with you, the processes are speeded up. So your metabolism is speeded up, so therefore your heart rate will be going faster. Yeah, okay. You might feel anxious, shaky, trouble sleeping, okay, and it can have also other effects as well on your nails and hair. All right, okay, and both can be treated, but we obviously need to understand if that's really what's going on with you. Okay, so what I'd like to do is give you an examination, if I may. Just look at a few things. Yeah, nothing's going to hurt you. Okay, and afterwards, if you're happy with this, I will like to give you a blood test, because there's one way that we can tell what's going on with your thyroid is by looking at levels of thyroid hormone in your blood. Okay, and that would indicate whether your levels are higher or lower, to indicate an overactive or underactive thyroid. Okay, and I am able to give a little ECG test as well today. I do have a machine here which can give an ECG. If I do think that there is cause for a further investigation with your heart, okay, if things do show to be a little bit unusual, I can refer you to our cardiology department for a more in-depth ECG. Okay, but the one I can give you today will give a picture. All right. Okay, so are you happy with that? And you're comfortable with that? Okay, all right. So let's just jot some notes there for a second. And then I'll get on with giving you an examination. All right. Okay. All right. So firstly, I should just get some gloves on. It's rather warm today. It's certainly warm in here. I can never quite get the temperature right in here. It's either too cold or too warm. All right. So firstly, I'd just like to check your body temperature, just to make sure there's nothing else going on. Okay, like an infection of any kind. You've not been feeling like you've had an infection or a cold or anything. All right, okay. So I've just got this device here. It is a thermometer, but it doesn't go into your ear. I'll just place it next to your skin. Okay, and you'll hear a beep or two. All right. So just relax, okay, and I'll just pop this around here a second. There we go. It's very quick. Yeah, that's perfect. Temperature is 36.8, so that's absolutely fine. Okay. Now I'd like to just check your oxygen saturation using this, the pulse oximeter. You've probably had this done before. Just pop it onto your finger and it just gives me your pulse rate and the amount of oxygen that's saturated in your system. Okay, so you can just give me your right hand there and I'll just pop it on your finger. There we go. That's lovely. Perfect. That's wonderful too. Your pulse is a little bit fast, okay, but your oxygen sats are good. They're at 98%, so I'm happy with that. Okay. Obviously, we do have to allow a little bit for elevated pulse rates in some patients, because sometimes people do get a little bit anxious coming to the doctor and seeing the white coat, get white coat syndrome. All right, okay, so that's fine. All right. Now I'd just like to have a little listen to your chest, if I may. Okay. Let's just undo that there for you. Is that okay? Okay. Just warm the stethoscope up a little for you. There. All right then. I'm just going to gently place this on your chest. There we go. And can you take a nice deep breath in for me? And out. Good. And in. And out. Okay. And in. And out. Perfect. Okay. And give me a little cough. That's wonderful. Okay, can you just breathe normally now for me? I'm just going to listen to your heart more closely. Okay. Okay, and just keep your head still. I'm just going to place this onto your neck. Okay, onto the artery there, and just have a listen. Okay, and again on this side. Okay, just relax for a second. Thank you. Alright, now I'm just going to pop this just round the back a little bit, and I'm going to ask you just to say 99 for me. Okay, and round here, and 99. Okay, and a little cough. Okay, that's fine. Perfect. Well, your chest sounds clear, so that's a good thing. Okay. So, while I've got the stethoscope, I'll check your blood pressure. Okay. You've got no history of blood pressure problems, I can see, so that's good. So, hopefully that will all be good today too. All right. So, I'm sure you've had this done before too. I'll just pop a cuff around your arm. I'll inflate the cuff, okay? So it'll go tight and a little bit uncomfortable maybe, but it won't be painful. All right, and then I'll just take the reading and I will do it on both arms for comparison. Okay, I always like to check both sides. All right, okay, so just outstretch your right arm here. Thank you very much. Let's get that cuff on. Around your arm. There we go. Okay, so let's just check that's all connected properly. Just going to pop the stethoscope to the crease of your arm and inflate now. Okay. Okay, that's fine. Let's just remove that. That feels better, doesn't it? Okay, right. You can relax your right arm and let's have a look at the left side. Okay. Let's put the cuff on. There we go. And I'm just going to pop the stethoscope into the crease of your arm again and inflate the cuff. that for you. There we go. Perfect. That's actually pretty good. Okay, so that was at 125 over 86. Okay. All right. So, could you just raise your hands and just pop your fingernails together for me? Just like that, okay? Just like that. Alright, let's just have a look. Okay, that looks good. That looks good. Right, now I'm just going to ask you to swallow for me. I'm just going to lightly place my hands on your throat, if that's okay. Okay, so I'll just pop those there, and can you swallow for me? Okay, and I want to just examine the lymph nodes in your neck and across your shoulders, okay, just behind your ears, okay, and just underneath the jaw. Alright, okay, just relax for me, okay. Just down the neck there. Just go to the occipital, just round there at the back. Okay. Just underneath and just across your shoulders there. Nothing feels uncomfortable or tender. No. Alright. That's fine, I couldn't feel anything unusual there. Okay, that's fine. Alright, I would like to take a little look inside your throat if that's okay. Alright. Has your throat been feeling sore at all? No, okay, just a little bit uncomfortable. So I'm just going to depress your tongue with this and just take a look around with my light. Okay, so open nice and wide for me. There we go. Can you say R for me? Okay. Alright, and again. Alright. Okay, I'm just going to move your cheek away with this on this side. Okay. There we go. And just have a look around the oral cavity there, and again on this side, just move that there, and just have a look. Okay. Could you just pop your tongue to the roof of your mouth for me? Okay. That's perfect, thank you. Okay, I'm just going to make a note of that. Just going to take a little look into your eyes. That's okay. So just look straight ahead for me. Okay, straight ahead. Let me just check the reaction of your pupils there. Okay, can you just look down for me? Okay, and up, 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 up. Okay, and on this side, can you just look up for me? Okay, up, 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 and down. Alrighty. Okay, now there is something I just want to check, because with thyroid problems you can get a condition called Graves' disease, which can make your eyes really bulge and protrude. Okay, so I'm just going to just have a look from the side just to see if anything looks unusual there. Okay, so just keep your head nice and still for me, and I'll just come round and just look there. Okay, and I'll just look there. Alright. Okay. you got any discomfort around your eyes when I press? Just gently press around. No? Okay, lovely. Right, before I move on to having a look at your skin and your hair, I just want to check your vision, all right? Okay, so I'll give you a couple of moments for your eyes to adjust after I've shone the light in them. Okay, and we'll just do a very, very basic test. Okay. Okay, see okay? Perfect. All right, firstly, you'll see the chart here behind me, the Snellen chart on the wall. Just want to check a little bit of your distance vision. Can you just read the top letter there for me? Okay. And can you just read down as far as you can go for me? Okay. Don't worry if you can't see right down to the bottom. Okay, that's great. Okay, can you just cover up your left eye for me? And just read that line there for me. Okay, and can you read that line there? Okay, now can you uncover that eye and cover up your right eye? Okay, and do the same. Can you read that line there for me? Alright, and what's that number there? Okay, that's perfect. So what I've got here is a pocket version of that, pretty much. Okay, and I just want to check your reading vision, okay? So I'm going to hold that up and I just want you to read that line there for me. Okay, can you read that line there for me? Alrighty, can you read that line there? Okay, and you'll see there's a little bit of text there. Can you read that for me? Okay, that's fine. I'm not going to check the individual eyes with that one, but that looks good. Okay, I just want to check. Can you see that there? Okay, and what number does that say? Okay, that's fine. No problems there. Okay. I'll give you notes. All right. So I'm going to have a little check of your hair and skin because you did say you noticed some changes. Yeah. Okay. I just want to actually check your nails first on your hands. So can you just give me your right hand and I'll just have a little check around. Okay, look for any unusual changes that may indicate thyroid issues. Okay, alright. And look at the skin on your hand while I'm here. I'll just get my magnifying light and just look closely at that. Okay. Alright. Okay. So you can just relax that side. And let me just look at this. Just look at your nails. Okay. Skin. Okay. Let's just have a little look with the light. Okay. I just want to have a closer look at the skin on your face, if I may. I will come close to you for this. All right? Okay. So keep very still. Just relax. This won't hurt. I'm just going to have a close look just at the skin on your forehead this side, on your cheeks, just on the chin area there. Just your ear. Okay, let me just have a look at the ear. Alright. And I'll just have a little closer look with the light there. Okay. Just having a close look at this right side of your face. Alright. Okay. And I'll just do the same on this side. So coming close to you, and let's just have a little press around on the forehead, cheeks there, and the jaw. And let's just have a little look at the ear. Okay, just having a close look around there. That all looks okay to me. Right. Just get the light and just have a little look again. Okay. Just see. You're doing all right. Fine. Okay. That's okay. There are a few little patches that look a little bit dry. Alright, jot a few notes down there. That looks fine on the hair. Let's have a look at the hair then. Okay. Just have a little look through the hairline just at the front there. Is that where you think you've lost some hair? Okay. It does look like there are a couple of patches, very tiny patches, where there could be a little bit of hair loss. You've got very thick hair, so it doesn't really look too noticeable until you lift up the front there and just part that just a little bit. Okay. Alright. So I couldn't see anything around the sides. It tends to be just a little bit at the front. Okay. Now, I just want to just check your reflexes. Okay, I've got this little hammer. Okay. Have you had this done before? Okay. Just feels a little bit strange when I tap, and obviously a reflex will make you jump a little. So let's just do this arm first, okay? Just let me have your arm, let it go really floppy. Alright, okay, and I'm just going to give it a couple of taps. Okay. Alright. It does make you jump. That's the whole idea. So that's good, that's working well. Okay, and again. Alright, lovely. And on this side. Okay. And again, nice and floppy. Lovely. Perfect. Okay, I'm just going to move down and just do your knee reflex, if that's okay. So just relax your legs. Let me hold the weight of the leg, okay? That's perfect. Okay. You alright? Good. Okay. And this side, just relax that leg. Okay, and one more time. That's lovely. Perfect. Well, they're working fine. Okay. Let me just update that. So with your hair, yes, there's a tiny little few patches I can see. Skin has a few drier patches. Now on your nails, they're generally alright, but I can see a little bit of pitting in a couple of them. But that can be caused by many things, even trauma. Right, okay. So for the next part of the exam, I'd like to give you the blood test, if that's okay. We'll get the results back within a day. Okay, so we'll be in touch with you tomorrow. Okay, so you just relax there and I'll get ready to take some blood from you. Don't worry, I don't need to take very much at all. Okay? All right. Make sure I've got everything ready. So, when you've had blood tests before, is there an arm that you're aware is better at giving? This side? Okay, let's just have a little look at that then. I'll just have a little pat of the area. Alright. Okay. I'll just give a little wipe. Okay. Okay, let's have a look at that again. I can see a good vein there, so that's good. I've got terrible veins. They're not very giving at all. So I'm just going to pop this tourniquet around your arm. Right. Okay. I'm sorry, that's got to be tight. There we go. Perfect. Let's just pat that vein a little bit. Sorry, that might feel a little bit uncomfortable now. Alright, we're good to go. Just get the syringe ready. Okay. And it's only a small needle, so don't worry. Okay. So you'll feel a sharp scratch, and I'll just take a small blood sample. Okay. Alright. Here we go then. Just relax, and a sharp scratch coming now. There we go. That's great. Just take the tourniquet off. Okay, don't need that now. That's more comfortable for you, isn't it? There we go. That's perfect. Well done. Okay, could you just hold this cotton wool on there for me a second? That's amazing. I'll just get this ready. Okay. And we'll get that off to our lab straight after our appointment today. Okay, that's lovely. So let's just check that now. Oh, that's great. I'll just tape the cotton wool onto there for a little while. So it shouldn't bleed, but I just like to keep the cotton wool ball on there for a while. Okay. Alright. And let's just tape that on there for you. There. All good. Relax across your arm there. You feeling okay? That's perfect. All right. All right. Okay, now for the final part today of the examination, I want to give you the little ECG. Have you had an ECG before? Okay. Well, it's just a way of looking at the electrical rhythm in your heart to see if there are any abnormalities. All right. Now, there are different types of ECG. Some use more leads than others. Okay. I only have a very small machine here, so I can just put 3 leads on, but that will give me a basic idea of if there's anything going on there, because you said you got this fast pulse. And it's just good to just check it out. Okay. All right. So let me explain. We have these little sticky electrode pads, okay? And I'll just place one top of your chest on each side and then a little lower down on your left side, okay? So they'll just stick to the skin, they're not uncomfortable in any way. And then I'll attach these leads, can you see this? To each pad. I've got black, red and blue, okay? And then I'll just ask you just to sit very calmly, okay? And I'll get the machine just to do a reading to monitor the rhythm in your heart, okay? And it literally is very quick, only takes a few seconds to do. But I just have to take a little reading to begin with just to get the base reading, okay? So you won't feel anything, it's not uncomfortable, just relax, okay? So just take some nice deep breaths, nice and calm, okay? And let me just have a look there at your chest, okay? Nothing to shave, so that's good, because some people, if they've got a lot of body hair, I have to shave just to get a good adhesion, okay? So let's just get the first electrode. See, they're very sticky. Okay, and I'm just going to pop this on your chest there. Okay, that's grand. Leave that there for now. Okay, let's get another one. Is that comfortable for you? Lovely. Just say if anything doesn't feel right. Okay, and this one just goes on there. Okay, perfect. And the last one is just going to go a little bit further down here. Okay, there we go. Lovely. So I'm just going to get the leads. Okay, and you'll just feel a little bit of pressure as I click it on. Okay, so that one there. Okay, that's lovely. Good. Feel that? Yeah, fine. Okay. Alright, and then this side. There we go. Okay, and just put this one down here. Alright, there we go. Brilliant. Is it all comfortable for you? Perfect, perfect. Okay, so I'm just going to have a look at my machine over here and I'll be pressing a couple of buttons. Alright, and that will just take a little base reading. Let's check that the pads are all secure. Alright, okay. Now just relax for me, and here we go. Okay. Okay, that's it. Painless. That's all. Right, okay, so let's remove these leads for you. Alright, let's that one off. Alright, okay. And this one. Okay, there we go. And this one here. Okay, there, that's lovely. Alright, so just got to remove your sticky pads now. Okay, don't worry, they don't pull when they come off. These are fabulous, they're the most comfortable ones we've ever had here. People say they don't feel a thing, so let's just remove this one. There we go. Lovely. And this side. Okay. And just the one down here. There we go. Perfect. So let me just have a little check now. Make sure everything's good. Yep. 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 Okay, that's fine. Alright, so let me just have a little look at the reading on the machine there. Okay. Alright, okay. There doesn't appear to be anything majorly wrong there. What I would like to do, there is just a little bit of an unusual rhythm. I would like to refer you just to the cardiology department, if that's okay, for another one of those, but there's just more leads involved, okay? And then there's a cardiologist that can have a look at it. I'm pretty sure this is all leaning towards you having a hyperactive thyroid. Okay, but I can't confirm that until we've had the blood tests back, okay? And I would like to get this other ECG done, okay, which will be done in the next couple of days. All right? Okay. Are you feeling all right at the moment? Good. If it's proven that your thyroid is overactive, okay, we can treat that. Now, one of the most popular and most effective forms of treatment is radioactive iodine. Now, I know that sounds scary, okay, but it is really just a capsule that you swallow, okay, and when the radioactive iodine is released into the system, it can very quickly stop the hormone overproducing in the thyroid gland. So it actually really can work quite quickly on relieving your symptoms and getting things back to normal with your metabolism, okay. We'll talk to you more in depth about that, okay, if that's the treatment that we need to give you. So don't worry about it, okay? It's something that we do very often, all right? And you would soon be feeling much better. Okay? So I'll get these bloods sent straight to the lab. I'll also get you referred, all right, to cardiology, and they will give you a call sometime either later today or tomorrow to get you in for that ECG. And by the end of the week we should have a bigger picture, okay, and we can look at what's going on there. All right? Okay. Well, thank you for coming in today. You've been a great patient, and I'll be in touch very shortly to look at the next steps, making you feel better. All right? So you take care. All right, and I'll see you soon.